In this morning's Health Watch, the CDC says kids 6 months and older with no underlying health conditions may receive COVID-19 vaccines, but parents should check with their doctor. So this contradicts Health and Human Services Secretary, that's Robert F. Kennedy Jr. You remember what he said last week, that COVID vaccines are no longer recommended for healthy kids. So here's a question: who should we believe what to do? CBS News medical contributor Dr. Celine Gounder is editor-at-large for public health at KFF. Good morning to you, Celine. This is so confusing, so sort it all out for us. Why the two different points of view here?
Yeah, this is very confusing, and frankly, it's been a very sloppy process. It's been a backdoor process, not out in public's eye, not in the eye of scientists who can break down what the decision-making is. Translation for shared decision-making, that means talk to your doctor. Now, not everybody has a doctor, by the way. 1 in 3 people in this country do not have a doctor. So that's one challenge. In terms of the kids, we know that kids under the age of 2 are those highest risk after the elderly for ending up in the ER or the hospital. And okay, most of them are not going to die, but as a parent, I don't think you want your kid to end up in the ER or the hospital. How do you protect kids between 6 months and 2 years? That they can get vaccinated. But under the age of 6 months, it's really pregnant women getting vaccinated and passing on those antibodies to their babies that matters. And the American College of Obstetrics and Gynecology has said, look, we've seen the data. So these are the experts of people who take care of pregnant women. They have said, we still recommend that pregnant women should be getting vaccinated for their own health so they don't have complications during pregnancy and for the protection of their baby.
So it sounds like you're going against what the Health and Human Services
I would
Secretary
agree with the obstetricians,
okay.
yeah.
And the FDA commissioner was on Face the Nation yesterday. He said the data on COVID shots in healthy kids is mixed. He called the CDC's independent vaccine advisory panel a kangaroo court that rubber stamps every vaccine. What do you make of his comments yesterday?
In terms of this rubber stamping, it's sort of like a graduation ceremony. All of this vetting has happened, but you still may not get that diploma. And in fact, in 1999, the CDC withdrew their recommendation for the rotavirus vaccine. So that is simply not true. This is really a process of transparency for everyone to understand why this vaccine is being approved.
I still think the best advice is talk to your doctor. You have a relationship.
That's the best we have right now.
Yes, that's the best we have right now. Thank you, Celine.